Yeah, in terms of the New Year resolutions, I mean, one of the common questions our viewers would like to know is, what's in terms of the growth, the budget and marketing and those sort of things, what's your feedback on that?
Okay, I can tell you now, with New Year's resolutions, budgets and marketing, there's one thing in common. Nobody writes them down. If you don't write down your New Year's resolution, it's not going to happen. And with a New Year's resolution, if you're as old as I am and you've gone through quite a few resolutions, you'll find that if you're not specific with that resolution, there's no way. If you're going to just lose weight, that's not a resolution. You need to set a target and everything else. Same with budgets. People think they know their figures.
Yes.
They go, oh, I just hope I do the same level of fees or I do more for next year. That's no good. You need to be specific. What does your production need to be next year? Are you going to have a close look at your expenses and everything else? Same with marketing.
You bet.
Yes, we're with a marketing company. Yes, we do some marketing. We do Facebook, we do SEO and all the other words and other bits in between. Nobody gets down and has a proper written marketing plan. And you'd have to agree with me that that's important.
Oh, 100%, Albert. There is, and that's what a lot of the time when I do the CPD lectures particularly is, this is a common question they ask, what is the budget? What is a ideal budget? And of course it depends upon practice to practice, but one of the things you just mentioned is the budget, which also I go with, many clinicians or practice owners would know 3R, which is retention, reactivation, referrals. But if I can add one more thing is revenue. What does the revenue look like for practice for this year, moving to next year? How does the budget keeping? How is the marketing tracking? It's all that important, yeah?
Yeah, no, very much so. So, well said. So there you've got it. You need to make sure you write it down. And one other thing, which is what I find good practice owners do, is they will find some time to be able to sit down with their accountant to review their figures and get a good understanding of their business and what it means. I don't see why any dentist, no matter how busy they are, can't afford 3 or 4 hours a year once. 2 2-hour meetings.
Correct.
6 months apart. If you're serious about your business, you need to get serious about getting in touch and sit down. Yes, we got popular with Zoom and everything else, but it's much better. Personally, I like to go out to my dental clients to their practice.
Yes.
Because I get to see some of the equipment that's not being used and other things with the practice. Also gives me a better frame of mind for exactly how their practice is operating. So really make sure that you force yourself, get a meeting, pay extra with your accountant. There's a sales pitch. Pay extra, you'll get it back in spade loads to be able to do that.
No, that's a great advice. I mean, I do all the time. I mean, even for the coffee meetings, I have just booked the time every month with the accountant. But one thing, Albert, if I can add there, yes, accountant may be, there's a little bit load for the accountants or the practice owners' accountants. But one thing we have also noticed, for especially the practices who are in a growth or scaling mode, I would also say is not just always on the practice, but about, I would say, half a day, if you could. I mean, I'm not saying whole 1 day production, but a half a day, at least for 3 to 5 hours, if you could, week by week, if you could just block that time and on the business rather than in the business. And I would like to see not in the practice, actually away from the practice, perhaps a restaurant, perhaps in a nice, even in the lounge, wherever you can. I think block that time, and going on the business is critical, because it's very difficult, right now, whether that getting the new patients, increasing the business, scaling the business, retaining the staff. There's 100 issues. So it is important to get the right headspace and give that time for yourself to see how does that looking for the next month or next week ahead. Is that right, Albert?
No.
Beautiful.
Exactly.